Have you ever heard the phrase time is brain? A stroke, a sudden health crisis, can strike at any time, claiming millions of lives worldwide every year. In just a moment, a stroke can change your life forever. But the scariest part is, many people don't even realize they are at risk. Imagine this: you are sitting with your family, having a pleasant conversation, and suddenly, a loved one can't speak clearly, and one side of their face starts to droop. Do you know what is happening? Do you know what to do immediately to save them? Today, we will explore 6 early warning signs of a stroke. Recognizing these signs can save your life or the life of a loved one. Based on medical research from the American Stroke Association, ASA, and top experts, we will analyze each symptom in detail, explain the science behind them, and most importantly, show you how to identify and respond quickly. What is a stroke? Imagine your brain as a bustling city where every street is a blood vessel carrying oxygen and nutrients. If a major road gets blocked or collapses, traffic chaos ensues, affecting the entire city. A stroke is just like that. From a medical perspective, a stroke occurs when blood flow to the brain is disrupted, causing brain cells to be deprived of oxygen and start dying. It happens in 2 major ways. Ischemic stroke accounts for about 87% of cases. It occurs when a blood clot blocks blood flow to the brain. Hemorrhagic stroke happens when a blood vessel bursts, leading to bleeding in the brain, often due to high blood pressure or a ruptured aneurysm. There is also a special condition called a transient ischemic attack, TIA, or a mini-stroke. These last only a few minutes but are serious warning signs of an impending major stroke. Risk factors for stroke. According to the National Heart, Lung, and Blood Institute, NHLBI, the following factors increase the risk of stroke. High blood pressure, the silent killer and the leading cause of stroke. Heart disease, especially atrial fibrillation and heart failure. Diabetes damages blood vessels, increasing stroke risk. Obesity linked to high blood pressure, diabetes, and high cholesterol. Smoking narrows arteries and increases the risk of blood clots. Age, stroke risk increases significantly after age 55. Genetics, a family history of stroke increases your likelihood of having one. Now, let's get to the most crucial part, the 6 warning signs you cannot ignore. Facial drooping. Have you ever seen someone suddenly smile unevenly, or one side of their face appears frozen? This could be the first sign of a stroke. Scientific explanation. When a stroke damages the brain area controlling facial muscles, nerve signals are disrupted, causing facial drooping. Quick test: ask the person to smile. If one side of their mouth doesn't move normally, call emergency services immediately. Arm weakness. If someone suddenly cannot move or feels numb on one side of their body, this could be a stroke. Scientific explanation. A stroke disrupts signals from the brain to the body, leading to weakness or paralysis on one side. Quick test. Ask them to raise both arms. If one arm falls or cannot be lifted, call emergency services immediately. Speech difficulty. Even a simple sentence like, "Today is a beautiful day," may become difficult for a stroke victim. Scientific explanation. When a stroke affects the language center of the brain, a person may have slurred speech, trouble finding words, or be unable to speak at all. Quick test. Ask them to repeat a simple sentence. If they struggle, call emergency services immediately. Dizziness and loss of balance. Suddenly feeling dizzy, stumbling, or unable to walk straight. Don't ignore this. It could be a stroke. Scientific explanation. When a stroke affects the cerebellum, which controls balance, the person may feel disoriented or fall. Quick test. Ask them to stand still or walk in a straight line. If they cannot, seek medical help immediately. Sudden vision loss. Losing vision in one or both eyes is a critical stroke symptom. Scientific explanation. If a stroke damages the visual processing area of the brain, the person may experience blurred vision, double vision, or complete loss of sight. Quick test. If someone suddenly loses vision, get them to a hospital immediately. Severe headache without a known cause. An extremely severe headache could be a sign of a hemorrhagic stroke. Scientific explanation. A hemorrhagic stroke increases pressure inside the skull, causing intense headaches, nausea, and vomiting. Quick test. If someone experiences a sudden, severe headache along with other symptoms, call emergency services immediately. A stroke is life-threatening, but the good news is that we can prevent and reduce the risk. How to prevent stroke. Control blood pressure, keep it below 120/80 mmHg. Eat a healthy diet low in salt, high in vegetables, fish, and nuts. Exercise regularly at least 30 minutes a day, 5 days a week. Avoid smoking and limit alcohol. These increase stroke risk. Manage diabetes and cholesterol. Keeping them under control reduces stroke risk. Get enough sleep and reduce stress. Poor sleep is linked to a higher stroke risk. What to do if someone has a stroke? If you suspect someone is having a stroke, remember the FAST rule. F face, check if one side is drooping. A arms, ask them to raise both arms. S speech, see if their speech is slurred. T time, if any signs appear, call emergency services immediately. Every second counts. Millions of brain cells die every minute during a stroke. Act fast to save lives. Today, you have learned crucial information about strokes. Share this knowledge with family and friends. You could save someone's life. Thank you for reading. Always remember, health is the greatest wealth.